The Prime Minister will be keen to reach an agreement with state and territory leaders today on the planned resumption of the school year. New South Wales and Victoria have been working on a proposal which is likely to involve widespread use of rapid testing. Meanwhile, more COVID treatments have been approved, while the Omicron wave continues to place pressure on health systems. Political reporter Tom Lowry joins us now from Parliament House in Canberra. Tom, g'day. So finding agreement among the states and territories might not be easy.
Yeah, good morning, Joe. The Prime Minister's already sort of been managing expectations, flagging that complete agreement among the states and territories at National Cabinet on how to run schools in 2022 might not be possible, but he does want to put together sort of a broad plan as to how they should run. The New South Wales Premier Dominic Perrottet has also been out this morning saying it is going to be a challenging year for schools. The end of last year in New South Wales was a bit challenging in schools. You had schools closing from time to time because of COVID cases. He's saying there's going to be more of that kind of thing in 2022. There is anxiety among parents and teachers about what the school year is going to look like because it's really very close at this point. I think schools in New South Wales are going back really in sort of just over a week or so. So there's an urgency to try and get this done. We know that rapid antigen tests are almost certainly going to be a part of the plan. New South Wales has certainly flagged that as well. The possibility of surveillance testing among students and teachers, but of course, National Cabinet is still battling supply issues of rapid antigen tests, not just in the school system, but right across the country. But the Finance Minister, Simon Birmingham, has been out this morning saying it's important to find a way to keep schools open as much as possible. Here's a bit of what he's had to say.
It is important that children don't suffer further as a result of COVID-19, that they do get every educational opportunity available to them, and that's why we are all working together across Labor and Liberal lines so cooperatively to make sure that we give the best possible chance for schools to go back, for kids to get back in the classroom, for teachers to be supported. This will require ongoing work around close contact definitions, around isolation rules, as well as this type of support from rapid antigen tests and the like. But all of that is possible.
And Tom, no doubt there'll be staff shortages in the education sector, just like there are in many other sectors at the moment when schools start because of COVID isolation requirements. What are the plans around that?
Yeah, Joe, there is undoubtedly a desire across the education sector to keep schools open as much as possible this year, but staffing shortages is going to be the crucial issue. And we're seeing some states already sort of putting together contingency plans to try and manage that. The key plan we've seen so far from New South Wales, where the ABC sent an email that's been sent to corporate staff within the New South Wales education sector who have a teaching background, who have teaching qualifications, flagging with them that there is the possibility they'll be called upon to fill teacher shortages, to fill shortages in the education system this year, to go in and work for a few weeks or perhaps even a month or so as a teacher where need be. In one email seen by the ABC, staff were told it's an opportunity to reconnect with the students we serve and the profession to which you bring so much experience and expertise. I got that out eventually. Victorian principals are also warning that there is the possibility of remote learning at times this year because of these teacher shortages, but they're saying where that does need to take place, it'll be very short and sharp.
And Tom, what are these new treatments that have been approved for COVID?
Yeah, we've seen 2 new oral treatments approved by the TGA this morning, and that's important because they're the first of their kind, the first oral treatments we've seen. They're called Molnupiravir and Paxlovid, 2 treatments. They won't be available from the chemist, so if you do develop COVID-19, unfortunately, you won't be able to go to the chemist and buy these over the counter or anything. They're going to be administered by doctors where need be, and they're only for vulnerable patients, people that doctors think their condition might seriously worsen. There are hundreds of thousands of these pills already on order from the federal government, 800,000 or so, and they're due to start arriving in just the next few weeks.
Okay, Tom Lowry reporting there in Canberra.